Hi, Frank Spanos from Empire Surgical, and today I'm going to talk to you about the anatomy of the shoulder. I'm going to break it down into three sections, one being bones, two being ligaments, and three being tendons. First up are your bones. Your first bone is your clavicle, which is the most anterior on the shoulder, which is also known as your collarbone. The second bone is your humerus, which is your actual bone, but the part we utilize and view in the shoulder is your humeral head. And on your humeral head you have two important parts, the lesser tuberosity and the greater tuberosity. And the third bone is your scapula. On the scapula you have your glenoid, you have your coracoid, and you have your acromion. The glenoid is like a ball and socket for the humeral head to sit in. And it's important to mention the labrum, because on the glenoid, the labrum runs 360 degrees around, providing depth and stability like a bumper for the humeral head to sit in. Then you have your coracoid, which is your most anterior on the shoulder in the scapula, and your acromion, which is the most superior on the scapula. Secondly, we have your ligaments. Ligaments connect bones to bones. There are 6 main ligaments that we're going to talk about, but I'm going to break them up into threes. The first 3 ligaments are located in the subacromial space. There are the CC, the AC, and the CA. The CC ligament is your coracoclavicular ligament, which connects your coracoid to your clavicle. The AC ligament is your acromioclavicular ligament, which connects your acromion to your clavicle. And the third, the CA, is your coracoacromial ligament, which connects your coracoid to your acromion. The next 3 ligaments are located in the glenohumeral joint space, and they are the superior glenohumeral ligament, the middle glenohumeral ligament, and the inferior glenohumeral ligament. All 3 of these ligaments connect the glenoid to your humeral head on your humerus. And lastly, you have your 5 tendons. Tendons connect the bones to the muscle. But the first 4 tendons I'm going to talk about are all part of that make up your rotator cuff. They run anterior to posterior in a question mark like shape. The first one is your subscapularis tendon, which connects your subscapularis muscle to your lesser tuberosity. Then working around the question mark, you have your supraspinatus, your infraspinatus, and your teres minor. All 3 of these connect their corresponding muscles to their greater tuberosity. And lastly, you have your biceps tendon. Your biceps tendon connects your glenoid, running through your bicipital groove, connecting to the top of your biceps muscle. This has been the anatomy of the shoulder, and I thank you for listening.